Hello friends, today we're gonna learn about the parts of the heart in reference to the blood flow into the heart. Starting from the dirty blood. From where the dirty blood comes in into the heart. From the inferior parts into the inferior vena cava, which is not visible on this picture, and from the superior part it enters into the superior vena cava. This is the superior vena cava of the heart. And then from the superior vena cava, blood enters into the right atrium. This is the right atrium of the heart. Then from the right atrium, blood enters into the right ventricle. This is the right ventricle of the heart. Right ventricle. But to enter the blood into the right ventricle, blood has to pass through a valve. What is this valve called? This is called tricuspid valve. Tricuspid valve. Do you know the purpose of this valve? The purpose of this valve to prevent the blood flow into the atrium from ventricle. Which ventricle? Right ventricle. Okay. Right ventricle pumps out the blood into the pulmonic trunk. To enter the blood into the pulmonic trunk, it has to pass through a valve. This is the valve. What is this valve called? It's called pulmonary valve. As we know, arteries carry the oxygenated blood and veins carry the deoxygenated blood. But here's an exception for the pulmonary arteries and pulmonary veins. The pulmonary arteries, these are the pulmonary arteries that takes the blood, the deoxygenated blood from the heart into the lungs. Then the oxygenated blood enters the heart through the pulmonary veins. The pulmonary vein that carries the oxygenated blood, these veins dumps the oxygenated blood into the left atrium. And from the left atrium, blood enters into the left ventricle and passes through a valve. What is this valve called? This valve is called mitral valve, or we can say bicuspid valve. Left ventricle pumps the blood into the aorta. This is aorta. Through a valve which is here somewhere, and this valve is called aortic valve. If we look deep into these valves, we will see it has cusps, and there are fiber-like strings that are attached to these cusps. These fiber-like strings, or these strings, are called Chordae or Chordae tendineae. And these things are attached to the cusps on one side, and on the other sides are attached to the papillary muscles. If you see clearly, there is a septum. This is the septum called interventricular septum that separates the two ventricles from each other, and it also prevents the mixing of deoxygenated blood into the oxygenated blood. If we talk about the heart muscles, this is all is the myocardium. Myocardium. This muscle here inside, this is the endocardium of the heart.